And share the screen. Okay. Once again, my name's Dr. Richard Kim, and this is our March 2024 uh, online seminar all about regenerative medicine and stem cell medicine. For those of you who are watching this from your phones or from home or a tablet, make sure you turn your volume up. Number one, and number two, be sure you can click the Q&A button. I believe it's on the lower right if you want to ask questions. For those who do ask questions, I'll just save all the questions to be answered at the end. So really what we want to get into today is really talking about how stem cells solve pain, as we understand that, pain is really the limiter in our life for a lot of different reasons, including quality of life. How do we go about changing that? Here's a good question and answer to start. This is coming from Corinne Elizabeth S. from area code 467, who asked more information regarding regenerative therapies for starters. And this is really what this is. This is just a very broad overview about what it is that we do, how it is that we do it, and then exactly how it helps. So we want to talk about what regenerative medicine is, but we also want to talk about who regenerative medicine helps. Nathalie L from area code 450 says, although I'm very active, I live with constant back pain. I'm looking for alternative methods of treatment. So this is a great question for us. We know that back pain can be constant, that back pain will be progressive. We'll know that, in 1, 5, 10 years from now, MRIs show that they almost always get worse. They almost never get better. However, after our injections and infiltrations, normally after injections and infiltrations of steroids, there's essentially very little options apart from steroids, and then this is why we're talking about this. Obviously, our process is different, and so we're trying to educate the public about this. We oftentimes have common goals, don't we? We all want some of the similar things when we talk about some of these therapies. We want, number one, to avoid surgery. We want to stop medications. We want to stop relying on medications. And we know some of these medications have some real significant side effects, and they can make us sleepy, to make us dependent on medications. And it'd be nice to live a life without it. And lastly, quality of life. We want something that's going to improve our quality of life, rather than just sort of prevent it from getting worse. The common goals, again, that a lot of us, when I think patients come to us, they want a plan. They want us to deliver a plan that has a lot of these same sort of elements. Number one, we want something that's low risk. Number two, we want a short recovery. We don't want to spend the next year in recovery from these therapies. And then lastly, we want to avoid any pitfalls. We want transparency. We want some straightforwardness about what it is that happens and how is it going to help us. And if there's limitations, we want to understand these things. We don't want to be promised the moon. Let's go through a couple familiar examples to our office. Number one, we're going to talk about a retired psychologist who flies airplanes for a hobby, also happens to be a runner, competitive runner previously, but also does it for stress relief, which we can all understand. Back pain, however, was ending his running career, running his running sort of life in stress relief. That meant no more competition, no more fun, no more stress relief. Unfortunately, the back pain was also limiting his flying time. He could really only handle about 30, 45 minutes, and then would have to bring the plane back down. Second, we had a chef who really enjoyed spending time with his family. The patient was in constant motion, though, as most chefs are. There was a lot of movement of heavy restaurant equipment, a lot of lifting of heavy boxes, etc. And this was really starting to affect his work. It was really affecting his work day. It was really making it difficult, even to the point where this person was contemplating changing careers. A lot of the therapies that they were going through, and we see this a lot in our patients, is that the current bag or the current group of therapies that most people go to miss the target. And then the problem with missing the target is that the traditional treatments are really fall under only a couple of categories. Number one is surgery. And of course, we understand surgery to be permanent. It's invasive, and they're often associated with these long recoveries and sometimes measured in the multitude of months. Lastly, medications is the other. First of all, we understand steroids. However, steroids can be a band-aid. They also have this unfortunate side effect of weakening and damaging tissue. And of course, when that happens, repeat steroids just mean repeat weakening and repeat damage of tissue. Next is over-the-counter medications. Sure, paracetamol, acetaminophen, ibuprofen, a lot of these medications are help reduce the symptoms, but when the effect wears off, then you've got to go back and repeat the dosing. And then the whole cycle continues over. For our two patients here in particular, after the stem cell therapy, number one, the psychologist that was able to return to running. He ran the local 4th of July race. It was a 4-mile race. Was unhappy about his pace at 13 minutes a mile, but I thought that was pretty good, considering that's probably faster than me. And then the other thing, though, it would really help him gain confidence to train for much longer runs. So the most recent check-in with him was training for a half marathon with his grandson, and I thought that was pretty neat. The chef, this is a little more pragmatic or straightforward, I should say, is back at work, working full time, able to provide for his family. So really being able to return to a normal life. This next slide is really one of the more important slides of all of this. We all understand pain, but we don't understand maybe always how that pain just seems to progress and makes our life worse. Pain, unfortunately, is the indicator that you are creating or progressing in degeneration. And then, of course, when you have degeneration, you then are led to yet more pain. And then this cycle sort of continues over and over until finally you get to a point where you're either seeking care, you're seeking therapy, you're seeking treatment, and looking for solutions. But for us, we talked about surgery, we talked about medication. For us, we really feel like this is the third solution. What do I mean by that? It's the third solution in that it is very much different than surgery and medications. What we're able to learn from the 10 years, the decade of having done this is that we have a fairly high success rate with this, meaning that it is applicable to quite a number of people with very, very great returns on the sort of therapy that we do. We're talking about a therapy that lasts years of relief, not just days, weeks, months. It's not repetitive steroid injections every week, every few months. It's not like surgery where you do one and then 2 years later you got to do another. And we're talking about something that has guaranteed acceptance. Because we are using your tissue to go back into your system, there is essentially there's no rejection. So what exactly is regenerative medicine? Regenerative medicine is a new field of medicine. The goal here is to restore and not replace tissues. The goal of what we want is to take damaged tissue into healthy and functional tissue. Different materials are utilized during this regenerative medicine process. Sometimes it's platelet-rich plasma, and sometimes it's stem cells. Platelet-rich plasma is great for, say, the green and yellow circles. So we'll say mild to mild moderate. Stem cells are typically better for the yellow and red, which is the moderate to more severe issues. Red is bad in this sequence and green is good. So this is a short repetitive clip here of where damaged tissue is in red and green is attacking those areas. The red is what's causing your pain, the stiffness, your sciatica, nerve pain, neuropathy, the shooting, the aching type symptoms. And stem cells essentially come in and attack all of that. One of my favorite examples of or analogies of describing this is Pac-Man. If you think about the pellets, which are all those little dots that Pac-Man consumes, are the inflammation. So let's say Pac-Man eats the pellets one at a time. That's very similar to what platelet-rich plasma can do. However, if you put a bunch of Pac-Mans on the screen all at the same time, that's kind of what stem cell does. The goal here is not to make it to the next level. The goal is to beat the game and leave the problem behind entirely. And when we do that, we're talking about something that lasts 5 to 10 years. So, not having to play that game of pain and pain solution for 5 to 10 years at a time. So where exactly do the stem cells come from? The spinning pelvis bone structure on your left is an example of where the bone marrow comes from. And in the case of a disc, we're injecting it into the disc, the degenerative disc there to help it become more functional, more viable, and then therefore taking pressure off of the spinal cord. What happens when you come to us? Well, the thing that we always like to start off with is a consultation. We'd love to meet you. We'd love to examine you. We'd love to hear how pain is affecting your life and how we can play a role in it. But once the consultation is done, the next step for us in pretty short order is obtaining an MRI. Platelet-rich plasma is the first in the series of 3 injections. Then for us, the second injection is more platelet-rich plasma combined with stem cell. And then lastly, the third platelet-rich plasma. Once this is done, we're sending people on to physical therapy, chiropractic care, exercise, home exercise programs to now then build upon what we've done, but also to help rehabilitate you from all those years of pain and developing weakness and balance issues and nerve disorders that you've accumulated over the years. So what do we treat? Well, when it comes to the neck and the back, stenosis is a very common example of what we treat. Arthritis, degenerative disc, sciatica. These are some very common things that we see. When it comes to the lower body, arthritis, bursitis, meniscus damage, Achilles tendon issues, upper body, rotator cuff, arthritis, more arthritis, tennis elbow, carpal tunnel. Well, of course, everybody wants to know whether or not they're a candidate. So the way that we can sort of describe this best is that if anything can be injected or operated on, it can be treated with stem cell therapy. For us, it's important, however, no matter however sort of simplified we make it, that the thing that's important to us is, of course, the diagnosis. If we have an accurate diagnosis, then we can ascertain, or we can figure out where the accurate location of your pain is. And of course, if we have accurate locations, then we can accurately apply therapies. Of note, our therapies, all of our therapies include an MRI, or I should say all our stem cell therapies include an MRI. We're probably one of the only regenerative medicine providers that have our own MRI. And so we're able to have that accuracy. We're able to have that pinpoint precision with which to apply the cells. What if you've had surgery? The answer is yes. For us, surgery is not a disqualifier, but it's important to have that consult. Again, we're going to want to make that diagnosis. We're going to want to see imaging, the history and exam of how you are still in pain, or the recurring pain from surgery is important. We'd like to see the type of surgery you've had, whether you've had arthroscopy or fusion or rotator cuff. These are the important details. How about some frequently asked questions? So where will my stem cells come from? And then for us, the stem cells, as we showed you, come from the back of your pelvis. When we do joint stem cells like hip, knees, and shoulders, we're often also taking fat, and fat just comes from your rear end, essentially. How long before I can then become active? So if you remember that timeline there between the second and third injection, the stem cell PRP and then the PRP injection, you're essentially shut down from any vigorous activity. We want you to live just kind of activities of daily living. No long walk and no heavy lifting is often what we say. But after that third injection, and when you're ready to get back into physical therapy, that's when you can really take on more and resume normal life, normal activity. When will you feel the next question? When do I feel the benefits? You'll start feeling the benefits typically within 4 weeks. Some people can take somewhere between 8 to 12. Typically, those who've had surgery before are the slower responders, but that isn't always the case. How long will the tissue stay repaired? So depending on what we're treating, spines tend to last somewhere between 6 to 10 years, and then more peripheral joints, knees, hips, shoulders, typically somewhere between 5 and 7. And everybody wants to know, well, how well this is work, or is this definitely going to work for me? It really depends. It depends, and it's person dependent, and what your issues are, the severity of what you've had, whether you've had steroid injections, whether you've had surgery on the area. So this is a little bit tougher to answer. So we certainly encourage everybody to take that next step of consultation. All right, so this is the part we're going to get into some Q&As that some of the viewers here have put to me, and so we're going to get through them one at a time. Denise R. from area code 315 asks how it helps degenerative disc disease, facet joint hypertrophy, bulging disc, and stenosis. So let's talk about disc disease here a second. Disc disease is really where jelly is leaving the donut. And those are my jelly donuts on the left, but the circular picture on the right, you can sort of see the nerve as it passes down past that blue disc. And if you can imagine that red jelly pushing into that area where that nerve is supposed to be, you can see why people would start developing pain. Facet joint hypertrophy, stenosis, these are all things that happen together. A lot of this is the result of arthritis. And so when we see degenerative disc, the idea of stenosis, facet joints, typically all happen together. What we do is really help keep the jelly inside the donut. So this is very different from surgery, and steroids, and everything else out there. What we do, again, is really helping keeping the jelly inside the donut. So Yves Andre, last initial G from area code 514 asked, suffered a herniated disc at L4, L5, pain subsided, but numbness in one toe, plus regular low back stiffness still present. Mobility is good, active, but not feeling 100%. Can we help? Again, even though you've herniated a disc and you've gotten better through, say, physical therapy or through acupuncture, and even through surgery at times, it doesn't change the fact that jelly is constantly and wanting to leave the donut. The jelly leaking is what leads to the continued pain, and really that donut has not been fixed. For us, stem cell therapy is that cellular fix And I wrote in parentheses versus a mechanical fix, which is typically what surgery is trying to do. It's trying to mechanically fix this unfortunate biological problem. So yes, we can help, but again, we encourage a consultation in your case. Jennifer E. from area code 518 asks, in regards to my husband who at 46 needs both knees replaced, if this is an option for him. So we do this for people who are facing knee replacement, hip replacement, shoulder replacement. Arthritis is the common theme for a lot of these people within these joints who are looking at replacement. We are the non-surgical method that really helps you keep your original body parts. We did a consultation yesterday where the patient said, you know, I just, the idea of losing part of my body just was very unnatural to them, and I can certainly understand that, and I could certainly feel the same way. But this is the way that would be the method that helps you keep all of that original part. Lawrence D from area code 518, how and what can be done to avoid surgical intervention? So for you, Lawrence, you know, how are the symptoms? How long, you know, how is the imaging? What are we talking about here in terms of what you're dealing with? Length of time is important. The chronicity of some of this is important. It has symptoms been there for a week, a month, a year? How long have you had this? These are the kind of things that we'd like to really sort of pull out of you from consultation, and that helps us formulate, you know, a plan that's going to ensure long-term for you. And of course, what area are we treating, whether this is back or knee? These are the important details. Tim G. From area code 908 wrote, years of past treatment and imaging told most of my lumbar discs are collapsed, significant spondylosis and stenosis, resulting in periodic sciatic nerve pain in my butt cheek and down my left leg, constant numbness and tingling, pins and needles in 3 toes on the left foot, and now newly developed to 2 on the right. I take gabapentin to assist in controlling these feelings for relief. In 2018, had a radio frequency ablation for pain management. Lastly, issues with C6, C7, creating numbness down the arms. How will Richard Kim medicine keep me from having fusion spinal surgery? So Tim, this is exactly what we do. And for everybody else, so lumbar discs in your low back, cervical, or the C6, C7 is what we're talking about when we're talking about neck level discs and nerves. The words spondylosis and stenosis are all terms revolving and in part related to arthritis. Gabapentin is a nerve medication, and radio frequency ablation is basically a nerve burnout. So you basically can't feel pain in that area anymore. So to go back to your answer, Tim, we are the true alternative to surgery. So we see people who are facing fusion, replacement surgery, rotator cuff surgery, and we've been obviously very successful at keeping the surgeon or keeping patients out of the operating room. Platelet-rich plasma and stem cells for us are biological therapies to solve a biologic problem. Our process is minimally invasive. It's in office. It's done within just a few short hours. And of course, everybody, you know, wants to know why bother coming to us? Why us? For us, it's really the experience. We've had 10 years of experience, and it's not just the cervical spine, as well as the lumbar spine and those with nerve-related disorders and you know, non-nerve related problems. But we've treated just about everything, you know, we can reach a needle to. And we've been doing this, again, like I said, for 10 years. So we've pretty much seen and done it all. Clinton S. from 518 asks, interested in non-surgical solutions to knee and shoulder. And Joan H. from 315 says, does regenerative medicine work on shoulders? Does Dr. Kim focus on shoulders? And whether or not we accept Excellis. So again, knee, shoulder, hips, even replacement. That really sort of, for us, tells us a little bit of information about your diagnosis and that you've got arthritis. And you most likely have progressed beyond what is just mild. A lot of people in your situation, Clinton and Joan, is that you've tried the steroids, you've tried the cortisone, and you're really faced with very few options. Surgery being really the next thing that's been offered by, of course, the surgeon. For us, really, stem cell therapy fills that gap of really a feeling like you've got no options. Steroids, surgery, and where we live is right in the middle. Stem cell therapy is the thing that has been, I would say, better proven than the cortisone, and better effect, as well as more joint or disc or bone or cartilage preserving than surgeries are. For us, shoulders are treated very commonly. Shoulders are complex, and therefore we always require an in-depth consultation with physical exam. And we don't, unfortunately, participate with any commercial insurances, and just they don't, unfortunately, recognize any of our therapies. Patty S. from 518 asks, regenerative therapy versus disc decompression. If possible, would like to access our seminar, so hopefully or webinar, hopefully you're here, Patty, as I need to be educated on both therapies, scheduled to meet with the doctor about decompression. So disc decompression, for those who don't know, it's where you put people on almost like a medieval rack type contraption, and you're really just sort of pulling people apart. But of course, once you do that, the moment you stand, then the compression comes back. So the idea was if you were able to pull people apart, then the jelly goes back in the donut. Unfortunately, it doesn't do anything for the donut itself. So it's oftentimes temporary, and the jelly is prone to leaving the donut once more. It requires multiple visits. 20, 30 visits is not uncommon. But regenerative medicine and stem cells allow for the healing of the disc and keeping, again, the jelly within the donut. And so that's where our therapy is very, very different from a lot of other offerings out there. Joanne L. from 518 asks, help for degenerative disc and back. And Don S. From 315 says, how to help my herniated disc and sciatic pain. This is a good moment to talk about the difference between degenerative disc and herniation. So when the jelly leaves the donut, and you can see that jelly donuts are a favorite of mine in terms of analogies. When the jelly leaves the donut suddenly, that's a herniation. When there's a slow leak out of the jelly from the donut, that's what we call degenerative disc. And of course, one puts you at risk for the other. For us, we really, we know this to be a better result than surgery. And we're talking about something that lasts 6 to 10 years. For you, Don, it's really about eliminating that pain. It's important for us to go over that risk and benefit perspective for stem cells versus some of the other things that you may be faced with in terms of trying to decide what to do. Again, we are the alternative solution versus surgery. Julie H. from area code 615 said, knee pain, stem cells for 85-year-olds. So at the age of 85, if you've got knee pain, there's a pretty decent chance that it's arthritis, but just in case that it's not. If you're feeling symptoms that are sore, achy, sharp, pressure type sensations, you're probably dealing with arthritis. A lot of our patients have difficulty with standing. Once standing, stay standing, find stairs very challenging. So of course the severity matters, whether you've got mild, moderate, or severe arthritis, whether or not you have additional meniscus tears on top of that, whether or not there's cartilage thinning, or if you've got no cartilage to begin with. So stem cells, in this case, provide excellent pain relief, even if you're 85. We've treated patients in their 90s regularly. And the important thing for us is that these therapies last years. It's not something where you have to do it all over again every 3 months or 6 months and have to make that regular doctor visit. For us, once a therapy is done, we just want to see you yearly. Come on, give us a high five and go on about your life. Jean-Claude L. from area code 236 says, continues to have back pain, even doing physio and massage, but keeps coming back. So you can sort of see that I put a building that's weathered in the background. And unfortunately, this is the representation of your back pain. Because over time, just like this building, your back is going to get worse. And despite the physio, despite the massage, you know, the weathering on the building is going to progress. So degeneration really is progressive, and year after year, you know that it is slowly getting worse. The typical recommendation wherever you may be living is infiltration and injections, but you're really sort of just delaying a more you know, longer lasting solution. For us, playing that temporary versus long-term solution game is I think not a great use of time, not a good use of resources. When we talk about infiltration and injections, you're talking about something that lasts, you know, at most maybe 3 months, versus when we do regenerative medicine and stem cell therapies, we're talking about something that lasts years. Nellie R. from 518 said, interested in stem cell therapy for knee that has been, quote, bone on bone for about 10 years. So for us, quote, bone on bone, in our experience, in my experience, is an overused term and then unfortunately a misused term. So bone on bone gives the impression that there's going to be an imminent collapse, that, you know, that somehow your knee is going to explode or your hip is going to explode. But you've just said it, you've been dealing with it for 10 years, so that's not the case. Cartilage normally provides that buffer between the bones, and the loss of the cartilage is what creates the inflammation and then creates the pain. So people with little cartilage, there are plenty of people with little cartilage with very little pain. And there's also people with early cartilage loss who have plenty of cartilage and lots of pain. So why does that not make sense? Well, the individual is different in how it reacts to that loss of cartilage. The other way I like to think about it, if bone touching bone is mechanical pain, why does steroid work as well as it does? If we're having this knee that's about to explode, then why does injecting a chemical make us feel better for 3 months? The problem is that it's a biological problem and not so much a mechanical one. If you said your knee catched and you know, you couldn't bend it and it was stuck, sure, that's a mechanical problem. But arthritis, by and large, is a biological. JL from area code 203 talks about relief from back pain diagnosed with stenosis of L3, L4, and L4, L5. Jay, we can help. If you look at the picture to the side, the blue is, when I'm going to say it again, the donut piece, and the center purple is the jelly. As you can see, the disc, as it pushes downwards towards that red area, is where you would start seeing stenosis. So that pushing down is where it progresses. And of course, we know, give it enough time, the stenosis is only going to worsen over time. What we are maybe a little bit alarmist about is when nerves are involved. Because if nerves are involved, everything is time sensitive. Because once nerves are permanently damaged, there's no recovery. There's nothing I can inject. There's no surgery that can be done that's going to revive those nerves. So either before it gets to that point or when it's in its earliest phases of that point, I certainly recommend people to have consultations. And even if you've had nerve damage, whether or not that's temporary or permanent, is something that we can help understand, or you can help us understand during our consultation. Paul C. from area code 778 asks, can stem cell therapy cure advanced level hip arthritis? And the simple answer is yes. So stem cell treats advanced level arthritis of hips, knees, shoulders, and I've said that before. It stops the effects of arthritis, the pain, the inflammation, the ache, the temporary catching, etc. We're talking about 5 to 7 years of effect with repeatability. The word cure is a little bit difficult for me in that it's not going to change the fact that you have arthritis, but it changes obviously how your body deals with the arthritis. And if we can help your body deal with that arthritis for 5 to 7 years, and maybe even push pause on the progression of the arthritis, I think we're doing pretty great there. Paul P from area code 514, and Bonnie R from area code 514. Also, Paul asks, I have spinal stenosis. Does your procedure cure it? Bonnie asking how I can get any relief from my spinal stenosis, L4-L5, and degenerative disc disease. So I put a tunnel in the background because to explain, another way to explain stenosis is to talk about the spinal canal as a tunnel. And I showed you in that prior picture with the blue and the purple in the center pushing down towards the red. If the spinal canal is the tunnel, then the nerve is the train leaving the tunnel. Therefore, if stenosis is the narrowing of the tunnel, then the tunnel is crowding around that train. Inflammation or pain is debris that falls on the train. Think about our procedure as the 10-year natural prop keeping the tunnel open and preventing further debris from falling onto that train, onto the nerves, therefore creating pain. So in a way, you can see how, though it looks to be a mechanical issue, the actual pain is being being caused by falling debris. And if we can keep that from happening, then we can help you stay pain-free for quite some time. Cindy from area code 607 says alternative to knee replacement. Again, this is a pretty common conversation for us, for people who are avoiding knee replacement. And a lot of people have had something, along these lines where you've had one knee replaced already, it wasn't a great experience, and you're really trying to avoid the other one, or they know about a friend who's had one, and they were never the same after the surgery. Or maybe even prior to going into looking into all of this, you've got a complex medical history, and you know that complications are higher for those with complex medical histories, and so you're looking for a different solution. For us, it's a broad range of applications. The spine, the knee are common, just because they happen to be common complaints for us. But absolutely, Cindy, this is the alternative to knee replacement. We're not a surgery. It's a very short procedure. In fact, in our 2 that we've done today, people walked in, walked out, and they were awake all the way through. Kathy S from area code 315 says, I am trying to avoid a hip replacement, so I'm seeking info on whether stem cell therapy is appropriate for my torn hip labrum. So I guess the question for you is, if you've got a torn labrum, but they're talking about hip replacement, it sounds like you've got more than just a labral issue. You've got an osteoarthritis issue, in which case it's not just a labral surgery. They're looking to replace the whole hip. In that case, I definitely would recommend a consultation to review your case specifically. But if it is this arthritis and labral tear combination, it is a combination that we see commonly. In fact, this morning's stem cell was a hip arthritis plus labral tear, and it's something we see commonly, we treat commonly. So Kathy, the answer to that is also yes. Christy from area code 315. Back and neck pain, already had back surgery. Is that going to be a problem? So surgery, it complicates things, right, for us. It brings up some important questions. Did you have a fairly straightforward, simple surgery, or was it a complex one? These sort of details are important for us. Was there hardware? Is there no hardware? And surgery usually means scarring, and how that scar is, potentially contributing to your pain now. That's an important factor for us. What surgery does mean is that consultation is key. It does not automatically disqualify you. It gives us a chance to learn about your surgery, your complications, your ability or disability from that resulting surgery is important. Patricia C. from area code 518 asks about the side effects. Pretty frequent question for us. Side effects, I mean, there's essentially none. We're using your cells to go back into you, so there's virtually no chance of rejection. There's no medications involved. There's no manipulation of the cells involved. There is a risk, however, because we are using needles, and so there's always a risk to injury, the nerve, artery, vein, muscle, bone, tendon, and also infection. But the chances is incredibly low, and a lot of it has to do with our expertise, and particularly my expertise with handling the needles and handling the sensitive structures that we're trying to navigate around. And with regards to the infection discussion, obviously very, very low. This all happens in our office, unlike hospitals where, the infection rates are high. The bugs, the super bugs that you hear about sometimes don't apply to us. Ronald A. from 315 says, I'm scheduled to have a hip replacement, looking for less invasive options. And that's it. For us, we're all about letting you keep OEM, the original equipment manufacturer. You keep all of your parts, let us deal with the pain, and put you back into your normal pace, your normal quality of life. For us, to tell you that we're serious about this, post-procedure wise, we don't have limitations. Whereas, post-knee, post-hip replacements, there are certain things that they don't want you doing. For us, there really aren't. And unfortunately, surgery is a one-way street, meaning once you head down that path and it doesn't produce the results you want, it's unfortunate that you can't come back to us and say, well, now what can you do for us, Dr. Kim? Unfortunately, they took everything that we needed to work with. Vice versa, for us, stem cell therapy gives you the option of surgery later. It does allow for the fact that if surgery is something that you need to consider down the line, it's still available. Harry DA from area code 518 says, would stem cell therapy help my mother with severe spinal stenosis, and is it covered by insurance? So even severe spinal stenosis is something that we treat commonly, frequently. It is something we see more and more of as people learn about stem cell therapy and what it can do for people. Consultation is obviously the next step for us, and it's key. There is no, unfortunately, there isn't any insurance coverage or commercial insurance coverage. Sean M. from area code 514 says, what can be done for my back stenosis born with spina bifida? Extreme weakness in my legs with pain. So for you, Sean, consultation is really going to be key. We really need to understand how the spina bifida has played a role into your stenosis. What's the quality of your discs? During and through all of this, we're really going to want to hone in and focus on any imaging that you've had before. And obviously, if you haven't, then we're going to want our own. But we have helped people with congenital conditions in the past, and so the fact that you have spina bifida doesn't disqualify you. Obviously, severity is important, whether or not you have EMG information, imaging information. Montanaro from area code 585 talks about a low back with an L4, L5 torn disc. So this is what we call an annular tear, and they respond incredibly well. We recently had a patient who had a repeat MRI within a year, and the tear is no longer seen. So going back to this purple disc idea, you can see as the purple starts to break down or tear, the blue in the middle wants to push that disc or push that blue material out. So that's really what it looks like when discs are herniating. That yellow in the center is your spinal cord, and the yellow sort of bulbs on either side are nerves that are exiting. So you can see the very close relationship that discs, and in particular herniating discs, have to your spinal cord and to the exiting nerves, and why you would, have pain. Dr. John A.D. from area code 315 says, can these injections appropriately treat multi-level lumbar spinal stenosis? And Dr. John, the answer is yes. Stenosis, as we know, is multifactorial. Our focus is to really biologically address the disc quality and function. This allows pressure to come off of the cord, off of the nerves. And, our approach is multi-level, meaning it's not just at that one disc, but we treat several discs all at the same time. Brenda B. from area code 315 says, questions on treating lumbar spinal stenosis, and similar to our answers for Dr. John there. And the problem with a lot of stenosis is that outside of Richard Kim medicine, outside of regenerative medicine, is that your options are in fact limited. Therapies for us last 6 to 10 years, and recovery is from home. Patricia L. from area code 315 asks, constant back pain left of T11 and 12, both had kyphoplasty, also T9 and fracture. So for those who don't know what kyphoplasty is, basically it's when somebody has a compression fracture or a vertebrae bone that has been sort of crushed. And kyphoplasty is the injection of cement into that area to help stabilize it. So this is a lot of thoracic level pain. For us, the cartilage end plate is where the fracture really makes an impact. The cartilage end plate is the pathway where the bone provides nutrition to the disc. So it's got to go through the cartilage end plate to the disc. Therefore, when you have a fracture, the ability to feed nutrition to the disc goes down. Kyphoplasty can help stabilize that, but ultimately that return of nutrition status is never going to be the same if you don't do anything. What we do in our stem cell therapy is provide that disc with a new path for nutrition. I oftentimes use the cabin out in the woods. If the cabin starts to break down and there's no road to get to it, that cabin's going to continue breaking down. But think about us as road builders, as we get a pathway in order to repair that cabin. Nancy L. from area code 973 said, interested in non-invasive treatments for sciatica. So sciatica, what sciatica is a singular nerve that is made up of a combination of other nerves. So when we say that we've got sciatica, there is something irritating that singular nerve, and it may be from high up in the path, or maybe low in the path, as I've illustrated in this these two circle drawings. So nerves essentially are wires from the spinal cord to the muscle, and sciatica means that there's damage, or it's seeing pressure somewhere along the path. What's important to us is whether that's temporary or is that permanent, and it's impossible to say over email or even over the phone. We really need to see you in person. We need to hear your story. We need to see that physical exam to really understand the level of that damage. Jean H. from area code 315 said, spinal stenosis, had the Minuteman procedure, helped me, but I still can't walk very far, can't stand very long, a lot of pain. Would stem cell help me? Simple yes or no. Simple answer is yes. And for those who don't know, that's what the Minuteman procedure device looks like, and basically it prevents you from arching backwards. Surgery can change the ultimate success rates for what we do. But for you, Jean, a consultation is critical to understand what it is that you're dealing with and how severe your symptoms are. Francis G says, I'm dealing with severe stenosis, herniated disc, and degenerated disc disease in my L1 through 5. So herniated disease, degenerative disc, stenosis are all closely linked for us. So the fact that you have all of this is not surprising, but areas, or I should say problems of the low spine that we commonly treat. Marie M said, which joints in the body stem cell therapy can help regenerate? What is the current success rate for each area? When is someone a candidate or not for stem cell therapy? What are the risks? How does the procedure work? How long is the recovery time? And what is the cost? So the best way that I can sort of describe this, Marie, is that if you take a messy pocketbook and you can't get to what you need to, it doesn't make the pocketbook very functional. The arthritis in a lot of these joints is making that pocketbook messy. What we do is go into that pocketbook and basically clean it out. Obviously, pocketbook's different. There's large, there's small, there's how much stuff that there's in it. Is it torn completely? Is it has it gone through the wash? Has it left out in the rain? These are all the sort of things that we want to know in talking to you. So success rates for us really vary on individual factors. What's important for you to understand too is the risks and benefit ratio, which are a little bit different for each of the joints that are being treated. Consultation is key, and I can't stress that enough. So Francis N is asking area code 315, COPD, neuropathy, and spinal stenosis. So some of the most common reasons that we use stem cells in regenerative medicine for is for spinal stenosis, neuropathy. We're also using it for some aesthetic type medicine. We're using it to grow back hair. We do additional therapies like vaginal rejuvenation for women who have issues with vaginal wall thinning, lichen sclerosis, and a couple of other reasons. To answer the question about COPD, we can help you with COPD, but there's a very specific protocol that has to be done with this. And so obviously we'd have to, have you come in and we can explain that to you and discuss it at length. But severity, are you oxygen dependent? Are you still smoking? Or if you ever smoke, is that still in the picture? These are all parts of this conversation that we'd want to know. So that's it. The offering to everybody who's watching this is that your consultation will be free. The catch to that is that you've got to call by this Friday at noon. You have to mention that you watched this webinar on March 20th here, and you have to schedule that consultation. If you'd like to call us, the phone number's there at 518-871-9900. For our Canadian patients, the phone number is 514-697-8919. Our webpage is richardkimmedicine.com. You can watch this webinar and all past and future webinars at richardkimmedicine.com/webinars. If you're interested in moving forward and want to obtain an MRI, want to get more information before you have that conversation with us, you can also go to richardkimmedicine.com/MRI, and you'll be able to simply order your own. Okay, so that ends our slideshow, and I am going to go back. And so if anybody has any questions, feel free to use the Q&A button there. I don't see any questions that have come through quite yet, but I'll hang out a little bit for those who do have questions, and happy to answer. Otherwise, hope to see you at the consultation for stem cell therapy. And of course, happy to answer your questions at that point. All right, everybody. Looks like we are good with the questions. I hope the rest of you have a great Wednesday. And oh, there is a question. Sorry, I almost got off there. This is from Paul C. For osteoarthritis, does stem cell therapy help regenerate the cartilage? And the answer to that is no. So you are not going to get stem cell therapy to regrow the cartilage. And the fact of the matter is that you don't need it to. What you do need is the um, uh, therapy to stop the pain that's arising from the degenerating cartilage. What stem cell and PRP have as additional benefits is that it can help slow down or stop altogether the progression of that loss of cartilage. So there are plenty of patients that we have that do not have much cartilage at all, but also have no pain. But they're running, they're cycling, they're walking, they're working out, they're lifting weights, they're doing everything that they want to do, and with very little cartilage. So the answer to that, I understand that it would be nice to see it having grown cartilage, but the answer to that is that it's not necessary. Another question here from Justin. Does the MRI have to be performed by you, or can it be done elsewhere to bill through insurance for the consultation? Yep, it can be done either way. If you want to have it done with us, happy to do it for you. If you have imaging, a disc, what have you outside, happy to review that MRI with you when you come back for the consultation. Either way works for us. And it looks like, Patricia, you've got a question. You've got your hand raised, but I think if you can type that question into the Q&A, that would be great. Somebody anonymous here. Why so much pain after the injection of the stem cell? So there is going to be some discomfort after the injection of the stem cell. There's an immediate inflammatory period. But oftentimes for our patients, we see that lasting somewhere between 4 to 5 days. And so we tell people, you want to keep close to home, you don't want to travel far, you want to lay low and just get through those 4 or 5 days. Obviously, we prescribe pain meds to get through that, and then help you to improve. Any other questions out there? I'm just going to give Patricia here a chance to see if she can type in a question for us. Another question by Paul. Can you elaborate a little bit what you mean by arthritis is a biological problem and not a mechanical problem? Right. So the inflammation that comes from cartilage being destroyed is what's driving the pain. When I say a mechanical problem, we're talking about where it is this bone on bone, the lack of the cartilage, what's driving the pain. But in fact, it isn't. It is the loss, it is the continual loss of the cartilage that creates the pain. The other way to explain that is steroids work for arthritis, but if we're going to describe arthritis as a mechanical problem, then why does injecting a chemical solution into the knee make you feel better? Well, it's because it's a biological issue. When you shut off that inflammation with steroids, you are in effect creating pain relief. So if you look at stem cell therapy, that's what stem cell therapy is doing in a very different sort of way, but obviously in a much more natural way and something that lasts, much longer. Steroid therapy, unfortunately, only lasts a few months, number one. Number two, steroids, because of its effects, can actually destroy a joint further and faster. So the shift of thinking is that we're moving towards a more biological solution for arthritis, rather than simply replacing the bones and the joints and whatnot. Justin, I hope that answers your question, Paul. Justin asked again, I think you're asking, can I treat more than one joint at a time? For example, a knee and a shoulder. So yes and no. So stem cells can't be done in two joints at the same time, but you can overlap that 3 injection set, one on top of another. So you could start with a shoulder and then overlap it with a knee. The reason why we don't do a knee and a shoulder at the same time is that it's much like splitting a dose of a medication between two people. Neither gets the effective dose. So whatever we procure at that moment, we like to dedicate towards that one joint. So it'll be just, for example, a left knee, then just a right knee, one at a time. But the overlap, able to be overlapped. All right. Any other questions? And of course, once this webinar is over and you have a question, happy to see you in consultation to answer further questions. Unfortunately, Patricia, I don't think we got to get to your question, but hopefully you'll find us and be able to ask. Otherwise, hope you all have a great Wednesday.